So, What's It Like is the name of our regular segment. And we always ask that question of people that we find involved in interesting activity. Perhaps we can ask the questions that you don't ask when you're talking to Richard Boals, President, CEO of Blue Cross Blue Shield. So what's it like to have the responsibility of providing health insurance for the nation? Not you individually, but this part of the country, and Blue Cross Blue Shield, of course, from coast to coast.
Well, as you know, Blue Cross and Blue Shield nationally covers about 100 million Americans. Here in Arizona, we cover about 1.3 million. So it is a big responsibility, but it's one that I have to say that I enjoy coming to work every day. It's an opportunity to do something to make being involved in the healthcare experience easier for our customers, better for our business partners, and my board is very supportive of making sure that we understand that we're part of this community, so we're out in the community trying to make that better as well.
Well, when you're out in the community, though, don't you also find yourself having to answer a lot of questions from people who are saying, so you're in the health insurance business, huh? Well, then how in the world am I, as a citizen, supposed to understand a bill that stands taller than most NBA basketball players when you put them all together and stack them up? I mean, affordable health care is a huge problem just simply by way of translation.
There's no doubt about it, and I'm happy to say that we have an absolutely wonderful, talented, committed staff that when they understood that ACA was going to be the law, took that challenge on with vigor, and we are as prepared to implement the law as we can be. Now we're hopeful that our friends in Washington are going to be prepared as well, and I have to say that when we're working with the rank and file employees in Washington, they're as dedicated to trying to hit these very, very challenging dates as we are. So as the President has said, I think there are going to be some speed bumps as we go through this, and I actually think the law will be retooled as the years go by. There are some things in there that just aren't going to work as well as they were thought to. But with the dedicated team we have, I think we'll get there.
All right, but outside of Blue Cross Blue Shield, as a very, very large organization, insuring the millions that you've told us about, when it comes to the insurance carriers in America in general, do you think that most of them would tell the rank and file that the Affordable Health Care Plan is affordable?
Well, I think we're going to find that there are some challenges in affordability. I saw a graphic not too long ago we were presenting to our board, and it indicated that coverage for individuals is likely, on average, to go up. And there are some individuals who are going to see that cost go up dramatically. The notion that somebody isn't going to have to pay for expanded benefits, or the fact that people who once were uninsurable are going to be in a pool, or that children can stay on policies longer, don't cost money. All of those things do, and in the net they're going to be expensive. Now the government is going to subsidize many people, so there will be new taxes. We estimate about 9% of premium will be devoted to new taxes, and those new taxes are intended to help be part of that subsidy for people who are middle income or lower income individuals.
But why does it have to be so complex when all the President would have to do is to pick up the phone and say, hello, Switzerland, listen, you've been doing this for a while and it seems to work over there. Send us your plan.
Yeah, I'm not a politician, and I don't know how they came to the conclusion that this was the ultimate solution. I do think there are simpler ways to get the job done. Shame on us as a country for allowing 40 million Americans to go without health care. Shame on us for allowing the cost of health care to inflate at 2 or 3 times the average market basket of goods over the years. but it's time for us to all work together to make sure that people have great coverage. One of the facts that keeps me going is this notion that people are living longer and healthier lives. You know, I'm amazed that when I was a younger person, the average age was probably 65. And you hear this in the debate about Social Security. Now people are living into their 80s, their 90s, and they're not only living to those ages, but they're more vigorous, they're more vibrant.
And I, for one, am really delighted that's true. Because when I was growing up, the average, I think it was about 14. This is Pat McMahon. This is What's It Like? And you can keep in touch with just about everything that you want to know in answer to that question on KTAR.com.